Welcome to SN Kidney 360 podcast. I'm Nobut's boy, IgA University School of Medicine. I'm joined by my colleague, Dr. Shinya Yokote, IgA University School of Medicine. Today, we will discuss our study entitled Predictors of Gross Hematuria following SARS-CoV-2 mRNA vaccination in patients with IgA nephropathy, published in Kidney 360. So Shinya, what were the methods of the study?
The study included outpatients with biopsy-proven IgA nephropathy who had been followed up before SARS-CoV-2 mRNA vaccination, and retrospectively analyzed the association between the remission status of pre-vaccination microscopic hematuria or proteinuria and post-vaccination gross hematuria.
What are the key findings for the study?
Pre-vaccination microscopic hematuria in patients with IgA nephropathy was associated with post-vaccination gross hematuria, regardless of potential confounders, including treatment history for IgA nephropathy. In addition, the severity of pre-vaccination microscopic hematuria correlated with the incidence of post-vaccination gross hematuria. On the other hand, pre-vaccination proteinuria was not associated with post-vaccination gross hematuria.
Did this study assess gross hematuria after first COVID-19 vaccination, or it include other COVID-19 vaccinations?
No, not limited to initial vaccination. Gross hematuria after repeated vaccination is also included. Indeed, the highest incidence of gross hematuria occurred after the second vaccination.
Was gross hematuria associated with changes in eGFR or eGFR slopes?
Overall, the eGFR slope in patients with post-vaccination gross hematuria was significantly greater than that in patients without post-vaccination gross hematuria. Post-vaccination gross hematuria was identified as the significant variable associated with the eGFR slope in the univariable analysis, but not in the multivariable analysis.
How long did it take for the hematuria to return to baseline?
Although gross hematuria resolved within a few days in most cases, the present study did not assess exactly how long it takes for microscopic hematuria to return to baseline after vaccination. In summary, pre-vaccination microscopic hematuria in patients with IgA nephropathy predict post-vaccination gross hematuria, regardless of potential confounders, including treatment history for IgA nephropathy. The correlation between the severity of pre-vaccination microscopic hematuria and the incidence of post-vaccination gross hematuria suggests that disease activity of IgA nephropathy is involved in this association.
Okay, thank you for joining us for this Kidney 360 podcast.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.